Hello beautiful angels, it's Kat. Welcome back to my channel. I hope everyone is doing great. In today's video, I'm going to talk to you guys about my first consultation before my surgery. And as I mentioned to you guys before, this is a very important step. It's a perfect opportunity and the time to express all your worries, all your concerns, and at the same time ask your medical staff all the questions that maybe bother you or make you feel unsure. I will share with you a list of questions that I've asked my surgeon, and I'll give you answers for those as well. For anyone who's waiting their first consultation, I really hope that you will find this useful and helpful, and maybe some other questions will pop to your head. But please remember that there's no stupid question. So if there is anything that you want to know, don't be afraid to ask. Remember that you are changing something inside your body, and you need to know what are the side effects and how that will affect your life afterwards. So before we start, I just wanted to add two very important things. First of all, please remember that I had my procedure done in a private clinic. So all the answers received from patient care coordinator related to document and paperwork side won't be relevant to anyone who's having surgery on NHS. So please remember that. Another very important thing is that those answers are based on my experience, my story, my body, and my health. If you want to know the answers for some of those questions, even though I will answer them, please don't forget to ask your doctor in your hospital or in your clinic, because even though the answers probably will be similar, there might be some differences based on our procedure, based on our health. There are so many different reasons why the answers could be different. So don't forget to ask them anyway. So without further ado, let's get started. For those who don't know, I had a gastric band surgery, and these questions and answers will be based on that procedure only. So before my first consultation, I will prepare a massive list full of questions, and I probably worked on that list around 2 weeks. And by saying I worked on that list, I mean everywhere I would be, let's say at work, at the gym, with my friends, and there would be a question in my head, I would instantly type it on my phone to not forget. My memory is very short, and I didn't want to miss a thing, because sometimes when I try to recollect those memories and recollect those questions, I just couldn't. So I really encourage you to type at any day, at any time of the day, of the night, those questions, so you won't forget and you will ask about everything you want to know. And the reason why I do this video is actually because I found those questions on my phone recently. I thought that I deleted it, but I found them, so I decided it's a perfect opportunity to do this video, because I know that there's so many of you that are waiting for your appointment right now, for your consultation date. I know during this quarantine and lockdown everything has been suspended, and I know it sucks, and I know that you're frustrated, but take it as an opportunity to find out as many things as you want to know and figure out what you still have to ask and put it on the list, so when you're going to go for your first consultation, you're going to be ready. Question number 1, can I take any painkillers during my period? And what I meant by that is, can I take any medications after my surgery? As I mentioned to you guys before, after your procedure, you are going to be on a liquid diet for quite some time. And as my periods are very heavy and painful, I wanted to know if there's anything that I can take. And the answer is yes, you can take medications after your surgery, but you need to remember that in your first 6 weeks post-op, everything has to be in a liquid form, including medicine. After that time, you can start to take a normal pill, but you need to remember as well that every medicine that is slow dissolving won't work as fast. You need to remember that it has to pass through 2 stomachs, so it won't work as fast. So bear that in mind. Question number 2, is flying safe? And if there's anything that I should avoid during flying? Well, you should definitely avoid flying in the first 6 weeks after your surgery, as you could put yourself at a bigger risk of having blood clots that could process to your lungs. When you fully recover, of course you can travel, but there are a few things that you need to remember. First of all, you need to remember that air travel can really affect restriction of the band. It doesn't happen to everyone, but if your band is already tight and you feel already pretty restriction, then you should consider a little defill before your travel. This way you can avoid complication and you can feel comfortable during your holiday. Remember, especially when you go to a warmer country, you will drink more to avoid dehydration, or you just simply will feel more thirsty. So you should really speak to your doctor about it to make sure that you're safe and you will enjoy your holiday fully without feeling uncomfortable. Another very important thing is you need to remember that your band adjustment shouldn't be later than 2 weeks before your flight. It's very important because within these 2 weeks, you are going to have enough time to work with your band, see if you can keep your foot down, see if you don't feel uncomfortable, if maybe it's not too tight, so you will still have time for an extra correction if it's necessary. Question number 3. Will I receive any card stating that I had a weight loss surgery? It was very important thing for me to have in case of any emergencies, and my clinic actually offers special patient card. So I didn't have to actually request it, even though I asked my patient care coordinator. She said, don't worry, you will receive in your house, and that's what happened. Week after my surgery, I received it via post to my home. So that's very nice. And the card that I'm talking about is this little card that it's very easy to keep in your wallet with you at all times. And on the card you can see the information about the gastric band, and in the front you can see my details, you can see the type of the band that I have, which is AP large, and you can see the date of the surgery. In this red line you can as well find helpline in case of any emergencies, or if something happened, or if you have any questions, you can always give them a call and they will be able to help you. It was very important thing for me to have something like this, because you never know what's going to happen. If I have to go to hospital, if there was any accident, if there's any emergency, I can always present this to my doctor, and you know, in case if they have to introduce any medicine or if they have to give me some treatment, they are aware that I have that inside, so to maybe avoid some sort of treatment or avoid some sort of medicine to not cause more complications. So it was very, very important to have something like that. Before I'm going to move forward, I just wanted to add quick that I know some of those questions might sound silly, and I totally get it, but you need to remember that I've never had a surgery. That was the first surgery ever in my life, and I've never had any experience in aftercare, in recovery, and I wanted to know everything. Question number 4. What do I do with the stitches? Do I have to go back to the clinic and get them removed, or do I do it by myself at home? Well, the reason why I ask about it is because I remember a few years back when I had a little accident and I had to have stitches on my knee, I still had to go back to the GP and get them removed. So when I compared a little stitching on my knee plus surgery, I really thought that I would have to go back to the clinic. Well, surprise, surprise, that wasn't necessarily. They came off by itself one by one. It was such an easy and smooth process. I was so pleased with that. And it was completely pain-free. Question number 5. Is my polycystic ovary pill not too big to swallow? For the last 3-4 years, I am on metformin medication. And I know that there's a lot of women who struggles with polycystic ovaries. And this kind of medication is not something that you can just come off. You have to carry on even after surgery. So I've been told by my doctor that this pill is simply too big to swallow and I have to crush it and drink it. What I've decided to do before my surgery is to go to GP and speak to them and ask them if there's any way to receive this medication in a liquid form for the time being for the recovery. And there is. But that was very strange and surprising news, because they didn't really want to give it to me. And when I asked them for a reason, they never gave me any clear answer. I have no idea why is that. Simply doctors, they don't want to prescribe you this liquid medication. Even when I took the prescription to the pharmacy and I gave it to the lady, she looked at me all weird that, oh my God, I received that from a doctor? So I was like, yeah, I mean, it's the same medication that I get for the last 3-4 years, but just liquid. What is the big deal, you know? So be prepared for that. So the prescription that I received lasted me for around 4 weeks, so it's pretty good. After that, I had to crush my pills and drink it. Little tip for you, because I know for every woman who take metformin every day, you know how disgusting it tastes. To make it a little bit easier to drink, I would suggest you to put it into the blended watermelon. It tastes way better, and you know, you can actually drink it without gagging, because that's what I've experienced. So little tip for you. Question number 6. How long should I be off from work? So the average time of the recovery after gastric band is actually 1 week. So it's not a long time. It's actually the quickest recovery out of all the weight loss surgery options out there. And to be honest with you, I decided to take 2 weeks off just to be on a safe side, just because I didn't really care that I'm going to waste this extra week off. But if you care, or if you don't have this extra week off to book 2 weeks, then a week should be definitely enough. If I will have to go back after this 1 week to work, I know that I would be ready because I felt perfectly fine. Question number 7. Is it safe to get pregnant after gastric band? I've been told by my doctor that most women who got pregnant after bariatric surgery will have their pregnancies without any complications or issues. You do need to remember though that after gastric band, during your pregnancies, you might develop some complications like band slip or band move that could lead to the severe vomiting. You will need to seek for the medical help in case if that happens. Gastric bands other than that is considered as the safest way and the safest weight loss surgery for anyone who's planning to get pregnant in the future. Question number 8. What could be potential side effect of the surgery and what could go wrong? You do need to remember that weight loss surgery, it is a surgery, and there's always chance to have any complications during that time. My surgeon told me that gastric band is actually by far the safest weight loss surgery option out there, so that was very good news for me. There are two different types of risk that you need to remember: the general surgery risk and the gastric band related risk. So the general risks, it would be bleeding, anesthetic reaction and mortality. Those risks, we're looking at less than 1% chance, but they're not zero, so you have to take them into consideration. So the most important risk in terms of gastric band would be definitely port leakage, band slippage, erosion, infection and inaccessible port. These are, I think, the most important ones that you should be aware of and you should take them into consideration. Question number 9. What are the advantages of the gastric band? Oh boy, from where should I start? Well, definitely the most important one is that it's totally reversible and adjustable procedure. You will go home the same day as the surgery. You will lose 50 to 60% of your weight within the first 2 years. And I know it doesn't sound a lot and fast because it's not as fast as the other options, but remember it's healthy and it's steady, which I think is very, very important. You will decrease medication intakes by 60%, and you will cure so many conditions like polycystic ovaries, diabetes, reflux, blood pressure, cholesterol, so many different benefits. The procedure is performed by minimal scarring, so you won't have a lot of scars as well. That's amazing. And you will improve your mobility. Question number 10. How should I know when my band is too tight or overfilled? Well, the first symptom that you will get is the fact that you won't be able to eat anything solid. So every time when you will try to eat something, it will stuck right here and it will cause massive pressure. The second symptom is reflux, called as well heartburn. Very uncomfortable. And the third one, the most extreme, is vomiting. So everything that you will try to keep down, you will just bring up straight away. If you will have any of those 3 symptoms, you need to let your doctor immediately and seek for his advice, because that means probably your band, it is too tight and they will need to remove extra liquid to open your band a little bit more to make you intake your food comfortably. Question number 11. Can I drink alcohol after gastric band? And even though I don't really drink anymore, I still wanted to know the answer. And the answer is yes, you can drink alcohol. The question is though, what kind of alcohol you want to drink after weight loss surgery? Remember that alcohol is very high in calories. So you should be very conscious and careful of what kind of alcohol you are going to drink. So please bear that in mind, guys, and don't go crazy because you are trying, you're fighting and you're struggling every single day. So this one night out, it's not worth it. Thank you so much, guys, for watching. If you like this video, please leave a thumbs up. If you want to be a part of my channel and my weight loss journey, consider to subscribe. And if you want to ask about something, if you want to ask some details about the stuff that I talked in this video, leave a comment down below. I'm looking forward to hear all about it. I'll see you guys in my next video. Stay beautiful, stay strong and stay safe. Bye, guys.